about the trauma and important MCQs in relation to the liver trauma. So first most important MCQ is that the most common organ injured in blunt trauma in penetrating trauma of abdomen. In penetrating trauma of abdomen, answer is liver. And the second most common organ injured in blunt trauma of abdomen, penetrating trauma of abdomen and blunt trauma of abdomen, answer again is liver. But if I am going to ask you which is the most common organ injured in blunt trauma of abdomen, answer is spleen. Okay, so in liver trauma, please remember first thing what you must have to do, we divide the liver into the following segments, and the most commonly segments which are damaged in liver trauma, answer is 6, 7 and 8 segments. They are mostly damaged in the you can say in the liver trauma injuries. Now whenever patient comes to you with the liver trauma, please remember whether the patient is stable or whether the patient is unstable. In both the condition, we must have to perform fast. What is fast? Focus assessment sonography in trauma patient, or in simple word you can say ultrasound. So in both the condition you must have to perform fast or ultrasound in the patient and look for any bleeding around the liver. Okay, for example, if the patient is stable and fast, for example, if the patient is stable and fast becomes positive, then you must have to go for CECT, and CECT will tell you which type of grading, and according to the grading you must have to perform angioembolization or exploratory laparotomy in the patient. If the patient is unstable and the fast becomes positive, then again you will go for what? Exploratory laparotomy in the patient. Okay, so whenever patient comes to you with severe liver injuries, please remember the mnemonic or management is 4 P's. So what is 4 P's? One is push, second is pack, third is plug, and fourth is the Pringle's maneuver. So what is push? See here in this diagram. Push is to approximate the round wound edges towards each other for compression. Packing, to pack the wound to ensure tight packing and compression of the liver parenchyma. Pringle maneuver I will explain to you. Plugging, direct plugging of the penetrating injuries. So push, plug, pack and Pringle. So 4 P's is the management of liver trauma. 4P is the management of what? Liver trauma. So see here in this diagram. In this diagram, he is showing you the Pringle's maneuver. Okay. So Pringle's maneuver, see here. This is the picture which is taken directly from the Bailey and Love. And as you can see that the packing to the liver is done to achieve hemostasis in the patient. So this is a packing maneuver in the patient. Okay. And this is the Pringle's maneuver. As you can see in this diagram, this is the Pringle's maneuver. So what is Pringle's maneuver? First, you must have to understand what is Pringle's maneuver. So in Pringle's maneuver, please remember, if the bleeding is from the portal vein or bleeding is from the hepatic artery, then Pringle maneuver, it will stop the bleeding. Okay, but if you perform the Pringle's maneuver and bleeding continues, it means the bleeding is from the inferior vena cava or it is from the hepatic vein. Okay, so please remember, bleeding is mostly effectively controlled by this Pringle's maneuver from the portal vein. Okay, and in your MCQs you must have to remember hepatic artery, portal vein, Pringle's maneuver will stop the bleeding. But if you perform the Pringle's maneuver and bleeding is not stopped, then you must have to think that bleeding is from the inferior vena cava or the hepatic veins. So now see this diagram. This is the liver, this is our stomach, and this is the lesser omentum. Lesser omentum is a double layer of peritoneum. Double layer of peritoneum. This lesser omentum, please remember, it consists of hepatoduodenal ligament, two ligaments, and gastrohepatic ligament. So this is your gastrohepatic ligament, this is your hepatoduodenal ligament. So what you are going to do, please remember, in this hepatoduodenal ligament or in the free margins of lesser omentum, you have structure present by the mnemonic DAVE. So what is DAVE? D is bile duct, A is hepatic artery, and V is your portal vein. Okay, so what you can do, you can apply here a pressure. Apply pressure. So how you can apply pressure? You can apply pressure digital also by applying the pressure from your digits, or you can apply the pressure by using these non-traumatic clamps. Okay, so by using these non-traumatic clamps, you are going to apply pressure in the free margins of the lesser omentum, and if the bleeding is stopped, because in these free margins you have this DAVE structure present, so if the bleeding stops, it means the bleeding is from the portal vein or from the hepatic artery. See here this diagram. This is also known as foramen of Winslow. Okay, so you apply here pressure digitally or apply here a non-traumatic clamp, and if the bleeding stops, it means the bleeding is from the hepatic artery or the bleeding is from what? Portal vein. Okay, so this is, you must have to understand. See here, a Pringle maneuver should be performed. Continued bleeding implies damage to the hepatic veins and inferior vena cava. So this is a very important MCQ which you must have to remember. So when you are applying the Pringle's maneuver, this is your portal vein, this is your what? Hepatic artery, and this is your bile duct. So if bleeding is from the portal vein, hepatic artery, Pringle maneuver, it will stop the bleeding. But if the bleeding continues, it means the bleeding is from the hepatic veins or inferior vena cava. Okay, thank you very much.